Hi, I'm Tal, the Educational Director at the American Academy of Functional Health, and I want to welcome you to this unique module on functional gastrointestinal disorder and metabolism. This is a part of our mini class series in functional medicine that will show you the functional medicine approach and how to find and address the root cause of chronic conditions. This is really helpful for providers to offer comprehensive care rather than just symptoms management. So let's dive into it. When we talk about gut health, we talk about two different aspects. The first one is our gut flora and the function of this gut flora in maintaining healthy metabolism and immune system. The second one is our gut integrity, which we're going to be talking about in a few slides. And when we talk about the gut bacteria, we know that there are multiple species of bacteria. There are about 100 trillion bacteria in our gut, which is about 10 times the number of cells in our body. There are somewhere between 300 and 1,000 different species of bacteria living in our gut, and different species of bacteria have different functions. In the same way that, for example, police officers patrol the cities to protect the citizens, right? While the military might mostly patrol the borders to ensure that the country or the state is remaining safe, right? In the same way that we have firefighters that have a completely different work when it comes to taking care of fires, right? In the same way, different species have different functions. For example, some species of bacteria help us with metabolism, and they help us to break down our food and synthesize different vitamins, produce butyric acid and other beneficial metabolites. And then we also have different species that are found to be helpful with healthier immune function, modulating the immune function, maintaining healthy inflammatory reaction to avoid or reduce the risk of developing an autoimmune condition or chronic inflammatory condition. And now we are discovering new exciting things about these bacteria, some of those species that are related to the connection between the gut and brain. And that's something that we're going to talk a little bit more about when we talk about the new term psychobiotics. So the gut bacteria is essential for healthy function, as we mentioned, and there are a few of those functions as example. For example, it produces short-chain fatty acid, it produces arginine and glutamate, which are energy sources for the intestine and immune cells. They also synthesize vitamin K in the large intestine and folic acid, has a role in drug metabolism, has a role in deconjugation of bile acids, which is a chemical reaction that changes the bile that is secreted from our gallbladder to become hydrophobic and less dangerous to our healthier bacteria. This also reduces reabsorption and increases elimination of bile with the stool. And then eliminating bile is important because many waste products are secreted with our bile. The gut bacteria is essential for additional functions such as prevention of colonization by pathogens such as Candida or E. coli. It also has immunological effect by protecting and maintaining a healthy balance. It stimulates production of antibodies, immunoglobulin A. It promotes the anti-inflammatory cytokines such as interleukin 10 and downregulates pro-inflammatory cytokines such as interleukin 6. And then it regulates regulatory T cells, Treg cells, which balance or suppress other immune cells to prevent inflammation or an autoimmune condition. The gut bacteria is essential for absorption and healthy immune and hormonal balance as well. So if you have a patient that has an altered gut bacterial composition, a condition that is called dysbiosis, it could be associated with the development of many inflammatory diseases and infections. Studies have shown that supplementation with probiotic, prebiotic, and symbiotic, which includes both, may alter the secretion of hormones, neurotransmitters, and inflammatory factors. Now, the tricky part is is not just using a general probiotic like the majority of the providers recommend or what most of the public is consuming, but using a specific research-based species of probiotic for each different condition, right? And again, as we mentioned, every different species of bacteria have different roles, right? In a similar way that if you have fire at your home, you're not going to call the police, you're going to call the firefighters, right? So you have to pick the right species for the right job. And that's something that we cover in much more depth during our training. Here's an example with a smaller scale study, 82 diabetic patients that were tested to look at their composition of their gut, and 75% of them were diagnosed with overgrowth of harmful bacteria in their gut. And there are multiple conditions that are impacted by dysbiosis of the gut, which means either alternation of the gut or alternation of the diversity, meaning a patient that is losing the diversity of the healthier bacteria, or maybe the overgrowth of the imbalance or pathogenic bacteria. Some of those symptoms include rheumatoid arthritis, irritable bowel syndrome or celiac, depression, anxiety, Parkinson's. So those are very common. It doesn't have to be GI symptoms to diagnose the patient, right? And for that reason, we look at functional labs. So we look at the symptomatic presentation. We can look at the functional lab testing, which offers a comprehensive view of the healthy, imbalanced, and harmful bacteria. And this is a snapshot from a 63-year-old patient who's suffering from years of back and hip pain, and she had no digestion symptoms, and she was taking drugs, supplements, probiotics, trying a variety of therapies, including physical therapy, including different injections. And she came to see us, and what we found out, interestingly, is that you can see she's got a nice amount of healthy or beneficial or expected gut flora, bacterial on the left side, but she also have a significant amount of imbalance bacteria and dysbiotic flora, as you can see there with Klebsiella. So this is why we want to test, right? Now there are newer functional labs that can look beyond the snapshot and diversity of the gut flora. There are newer labs that can also show us about the fungal flora, look for parasites, and of course, tell us about metabolism, right? Metabolism of carbs, fats, and proteins. So for example, here's a snapshot from the same patient, and you can see here that the elastase levels are lower, which means that her pancreas does not secrete enough of that enzymes that is really important to break down some of the food that she's eating. And so you can look at different markers, metabolism of breakdown of fat, protein, fiber, carbohydrates, looking to see if the patient has sufficient amount of those enzymes or hydrochloric acid. So that will all give us information that, as a practitioner, helps you to determine the root cause of your patient's symptoms or chronic disease.